The REFOHCUS project is supported by SICAP, which is the Social Inclusion Community Activation Programme. And SICAP is, I suppose, one of the underlying themes of SICAP is collaboration. We would understand that issues like poverty, like educational disadvantage, like inclusion, they're very complex and they're very multifaceted. So there is no one kind of organisation that has all the answers when it comes to those kind of issues. So that's why projects like REFOHCUS and strategic partnerships like with UCD, they're vital for us in terms of leveraging in additional resources and getting best outcomes for our clients and our community.
It's been great working with UCD School of Veterinary Medicine on the project. A lot of our involvement was the recruitment process and to make sure that the lecture series itself was advertised in an effective way. So we started first with some of our local community groups. So we would have had the Ballyfermot Adult Learn Together group, the Ballyfermot Disability Action Collective would have been involved from the very start. We also would have recruited through a poster campaign, leaflet drops to houses, and also an email campaign as well to our client base. So we were very keen to have as many people involved as possible and to disseminate that information as far as possible.
My name is Grace Mulcahy. I'm a professor in the veterinary school in UCD, and I'm also the leader of the REFOHCUS project, which is funded under Science Foundation Ireland's Discover programme, and it's an outreach programme to encourage the public to get involved and get engaged with science and scientists.
And REFOHCUS is reimagining the future, One Health, COVID and us. And it's basically a science education project to inform local communities about science education, specifically around the COVID-19 pandemic and Ireland's response to it. We met up with two communities, so here in Ballyfermot and with Dunleary Rathdown. The staff here, along with Antoinette and Trina, have been great at informing local groups, communities, things like Men's Shed, the Disability Access groups, the adult education groups, to kind of inform them of what's coming up in our monthly webinars, and they've been a really key help. And we've learned that there's been a lot of key participants from Ballyfermot involved in our project, and a lot of people within Ballyfermot, they've been really passionate on being involved in this project. What we've been doing over the past couple of months, since June I believe, we've been doing webinars on a monthly basis. A lot of things came up, like with the origins of COVID-19, how vaccines work, as well as mental health during the pandemic, the community work that kind of just went through the roof since the pandemic. So just things like that, as well as the information and the disinformation that's been brought around during the pandemic.
So science is often talked about as if it is very certain, and one of the big things about medicine is that there is some perceptions in medicine that it's not entirely a science, because a lot of times we have to deal with uncertainty, and often we have to. Medicine is often not about acting on the best evidence, but on the best available evidence, and sometimes evidence isn't available.
This is really what threatens our future. It's not necessarily an army coming over the border. What threatens our collective future is mismanagement of our environment. What threatens our collective future is an emerging disease that will take away our kids and our parents and disrupt our economies, like now for a year and a half and more to come. So the real issue for us is we both have to be scientists and activists. And I'm very clear on that, and probably get, in WHO, in a UN organization, that's not always politically correct to say. But we do have to be, within our constraints, be both scientists and activists, and they are not incompatible.
COVID-19 has had a huge impact on the community. The school closures and the move to remote learning has really, I guess, exacerbated the educational inequality for the local area, and it's really highlighted sort of the deepening digital divide as a lot of students have had to move to online schooling. This is where the REFOHCUS lecture series comes in, so that people in the local area will have access to those experts. and also to just give them a space to, you know, ask questions and to have that discussion and debate as well, to really tease out some of maybe the information that they've received.
Do you think that the natural immunity is more powerful than the vaccine immunity in the case of SARS? There is a question there, why, you know, we don't go with natural immunity, you know, compared to vaccine immunity. What's your thoughts on that?
Yes. Can you talk about COVID gene-based vaccine injuries and death, which is the highest for any vaccine in the last 30 years?
Well, in actual fact, like Austin had really nice figures there. I loved that graph that described the risk of that really rare clot that is happening in some women. It's astonishingly rare.
One of the reasons that we initiated the REFOHCUS project, or that we partnered with UCD on it, is that we are seeing a rise in kind of misinformation and disinformation, particularly around the pandemic and vaccines and things like that. So I think REFOHCUS is a really healthy way to address that, because it's not about polarizing, it's not about being in your echo chamber and only talking to people who agree with you. A big part of the webinars is the question and answer sessions. So providing that kind of respectful and supportive space where people can have a different opinion and they can ask questions. I think that's really our best way forward in terms of bringing people together and continuing a dialogue.
If you don't come from a science background, the terminology, the wording that was being said on the news, it's really hard to follow and to understand for normal people. Like my grandmother and experiences I had with other people, they were really confused. And not many would think to go off and maybe talk, Google it or research it or whatever. So the REFOHCUS project was huge in actually breaking down the science, for people to actually understand what was going on, what was the virus, what were the things that were being put in place, why were they put in place. So it was really to actually inform people on a level that everybody could understand.
You were listening to experts speaking about it, so you were getting what they call it, you're getting a chance that maybe you wouldn't normally have to, you know, sort of listen to sort of good information. It's good for people like to be participating in that, because it gives them a chance. Like, you don't have to be an academic yourself or that, you know, to what do you call it, to be able to listen and get what do you call it, good views on it. No, it's nice to attend it, but it's good to be able to access it then, you know, online and that.
The project's been absolutely phenomenal. To have these like high profile speakers, to have access to them and to be able to listen to the debate and then take part in it has been unbelievable. I know feedback from participants that they've just found the whole experience really enriching, and not just in terms of like, you know, the urgent need for information in relation to COVID, but just kind of maybe sparking that curiosity. I could see quite a few of our participants applying for science-based courses next year as a result of their experience with the REFOHCUS project.
Access to the best quality scientific information is something that we really wanted to provide within the community. There is so much information out there, it is confusing, it's very difficult for people to navigate. So a lot of what we do is about matching people within the community with opportunities, and in this case we've had amazing speakers, we've had really, really interesting webinars, and I think as important as that is the questions and the conversations and the dialogues. So we don't know that it's going to change people's opinions or people's minds, and that's not necessarily the aim of it. I suppose what our aim is to put the information out there in a way that's accessible and let people come to their own conclusions. And if it opens a few minds in terms of pursuing further education or opportunities in STEM, then that's all the better for us.
Epidemics begin and end in communities. Solutions begin and end in communities. And not only does the public sector have to serve communities, but the private sector does too, especially at times like this.